Hi, Mr. B. My name is Andrew, and I will be your student nurse today. We did receive the doctor's orders for a catheter replacement. Would it be okay if we do that today? Okay, excellent. So I'm going to go ahead and wash my hands here. And before we get started, can you tell me your name and date of birth? Okay, looks like it matches your ID band. And do you have any allergies to latex or iodine? Okay. So we have the door closed and the curtain pulled for your privacy and comfort. And so the reason why we're doing a catheter replacement is to help prevent any fall risk. So right now you have a little bit of immobility, and this will help empty your bladder as well as reduce the number of trips you have to take to and from the restroom, which will help prevent fall risk. So now I'm going to wash my hands again, and we'll start with cleaning your perineal area. I'm going to don my clean gloves here, since I have my supplies over here already set aside. Oops. Okay, and I'm going to get this waterproof pad, and help me lift yourself up. I'm going to slide the waterproof pad underneath you, and this will help keep the bed dry and catch any additional fluids that may come out. So now I'm going to wipe your perineal area on the penis, tip of the penis shaft, and go down. And again, I'm going to wipe your penis tip and go down the shaft. And it's okay to let this air dry, and so we'll give you some time there, but in the meantime I will clean up and remove the waterproof pad. And remove my now dirty gloves. So now I'll wash my hands again and get my sterile kit with the catheter. We're going to open the kit outwards, and then we're going to assume that the outer 1-inch border is not sterile. I'm going to grab the sterile gloves and place it. Now I'm going to open the sterile packaging outwards and use my left hand to grab the inside of this cuff and put the glove on my dominant hand. Okay, now my right hand is sterile. So I'll grab this packaging. Now I will put my sterile hand inside the cuff and put the glove on my non-dominant hand. Okay. And now my hands are sterile. And so now I'll get the sterile pad, wrap it around my hands here, place it underneath you, and this will create a sterile field underneath. And now I'll place a fenestrated pad to cover the penis here. Okay, so now I'll get my supplies out here. I will open the iodine and pour it here. And then I will open the lubricant, pour it over there. Now I'll get the 10 milliliters of normal saline syringe and attach it to the syringe port. And normally I would remove the wrapper from the catheter tubing, but since it's already been done, we don't need to do that. And so I'm going to use my non-dominant hand, and Mr. Jones, I'm going to touch you, and I'm going to put my non-dominant hand and hold the penis in place for the rest of the procedure. And I'm going to grab a cotton swab and swab the iodine. And I'm going to clean the meatus and then go in the circular direction outwards. I'm going to do the same and repeat. Dip the cotton swab in the iodine, clean the meatus in the circular outward motion. And on the third one. Okay. Now I'm going to grab the catheter tip and dip the first 1 to 2 inches in the lubricant. And now, Mr. Jones, I'm going to insert the catheter right now. And I'm going to advance it until I get to the Y. Okay. So now we're at the Y. I'm going to use my non-dominant hand and grab the Y and hold the Y in place. Oops. And I'm going to inject the normal saline. And while holding the syringe plunger, I'm going to twist off the normal saline. And now I'm going to feel for resistance. And I do feel some resistance so that the catheter is in place. Okay. So now I'm going to attach the catheter to the patient's thigh with some tape. And then I'm going to hang the catheter on the bed frame. Now I'm going to remove the, do a little cleanup here. Box. There we go. I'm going to remove my gloves. And now I'm going to reposition your bed, get you to a good comfortable working height, or back to where you were before. I'm going to put your call bell next to you. If you need any assistance, please let me know. And then I'm going to check again the tube just to make sure. I don't see any kinks or tubing. Looks like the urine's flowing from the gravity. So it looks like we're good here. So if you have any questions, please let me know. But I'm going to do hand hygiene. And we're done for the day.